Hi everyone, thank you very much for tuning in. For those of you who don't know me, I'm Louis. I am the Community Services Lead here at SMA UK. And today I'm joined by Portia, who is our Advocacy Lead here. And Portia, I know that recently you traveled to Prague on behalf of SMA UK. So before we get into those details, what did you get up to? Who did you meet? What did you see?
Well, it was very exciting. So yeah, I travelled to Prague as the UK delegate at SMA Europe. So it was a really, really great opportunity. So went in there and we were put up in a nice, interesting hotel, shall we say, in Prague. It was outside Prague, actually, about 40 minutes outside Prague. So I went with a lady called Vanessa Christie Brown. So Vanessa... she used to be our research person. So if we had something scientific come in that we wanted to put out to the community, Vanessa will look through it and make it readable and understandable. So she travelled with us. Now she actually works for SMA Europe now. Does a little bit for SMA UK freelance basis. Yeah, so we were put up in this hotel with all delegates from around Europe. So there's lots of countries represented there, mainly people like you and I, Louis. So people living with SMA and parents of children living with SMA across Europe. So it was super interesting just to listen to their experiences and, you know, what the treatment's like, what their care is like, and making friends and socializing with them was a small part of it. So on the first day we were there, I'm part of the SMA Europe Treatment Committee. Now, the Treatment Committee is a sort of a group of, I think it says on the website, expert patient advocates. I don't want to have an expert, but so we sort of develop common positions on a wide range of biomedical topics, which sounds very fancy, but basically what that means is we meet with the pharmaceutical companies that have an interest in SMA. And they talk to us about everything really, from the trial design to, you know, what's it like living with SMA? What's it like on the ground? What are the gaps in, you know, what the gaps that need filling with treatment, if you like. And that was really exciting because to get to speak to the pharma companies, you know, about treatments before they've even started the trial process to make sure that their treatments are really meeting the needs of the people was really great. Because we do find sometimes in trials that they're aimed at a very sort of niche section of the population, like they might be for age 6 to 20, and then you're eligible for the trials. But then when it comes to getting those drugs licensed, you know, NICE might say, yeah, but there's no evidence for over 20s or under 5s or children who are adults who are trachea vented, children who are trachea vented. So we as a community, and because it's all the patient groups across Europe, makes a much more powerful voice to the big pharma companies, saying that there's a big section of the community missing out on here. So that was a really great opportunity.
That sounds like it. I think someone who is on treatment and realizing that it took a long time for it to get to this point, at the age of 37, it's really, I can really relate to that.
Yeah, and as you know, there's lots of countries where people your age just don't get treatment because
definitely. Yeah, well, where I'm originally from in South Africa, it's not available. No. You'd have to be very, very wealthy to be able to get treatment. So, yeah, that's really interesting. So, you made a couple of mentions of SMA Europe. So I think it would be great to share what is SMA Europe and why it's important that SMA UK is part of that network.
Yeah, sure. So SMA Europe was set up, I think it was around 1990s. I'll check my facts. Actually, Keras, who's one of our trustees, was a founding member of SMA Europe. And it was set up really to raise money and fund research into SMA. So it's sort of a non-profit umbrella organization of SMA patient organizations from across Europe. And the idea is that we work together to bring effective treatments and tool care to everyone living with SMA. Basically, that's really cool place to be.
Okay, and what? How do we contribute to that umbrella thinking and planning and orchestrating?
So they have quite a small actual staff team, but lots of delegates. And if you go on the SMA Europe website, you can see sort of how many delegates there are, the countries they come from, and also on there are their research priorities. So they set up these projects, and then these projects go across Europe to all the countries for people living with SMA to take part in. So, for example, there's a project going on at the moment that people can take part in called the Priority Setting Project. So they're trying to find out what the top 10 unanswered research questions are on SMA from people living with SMA. And then when we find out what those top 10 are, for example, I did the survey, one of my big bugbearers is peg feeding. My son is entirely tube fed. And the feeding pump machine and the line that goes into his stomach, I just find it really like clunky and annoying and borderline dangerous if you put on it. And I just think surely there must be someone that's invented something that does this in an easier way. So that would be one of my top priority settings. But we might have something completely different. And the companies that are able to make these things, they don't know what it's like living with SMA. So it's really important that we put our voice into these projects. Another project they're doing, which is super cool, and I'm really excited about, is called Smart Horizons. They like to put SMA at the beginning of all their little projects. The Smart Horizons. So they've asked each country to have a scanner, and that person's job is to look at what's going on in their country in other disease fields and in small labs maybe. So it might be, for example, spinal injury. They might be doing something really revolutionary in spinal injury that we could be used in SMA. So the scanners go out and do lots of research and find out what's going on in universities, and then they take that back to SMA Europe, who look at it, and the SMA Foundation are involved. So the SMA Foundation are in America, and they do the Cure SMA conference and all that. So they got some money, the SMA Foundation. So they've said if we find things in Europe that are really exciting, they will give us money to go to these labs or these universities and say, hey, look, if you put your research into SMA, we'll give you this money. So it's raising awareness and it includes things like robotics and like literally anything. So if anyone sees anything out there that they think that's cool and could be used for SMA, ping me an email. They'll take it.
Yeah, that does sound really interesting. Cool. I think there is a lot out there in the world that's going on, and I think that's a very clever way to identify things that can help us. I mean, whilst SMA is a very niche condition, there are very similar conditions out there, and there are very similar challenges that need to be overcome. And like even being in charge of the podcast, I try thinking that way as well, that what we share on the podcast can probably help other people with disabilities, not just the living with SMA community.
True.
So that's really great to hear that that's going on. So you mentioned some of the projects and the importance. What are some of the other ways that we at SMA UK or some of the community members can help contribute towards the active ongoing projects?
I would go on to SMA Europe's website or contact me, because they do have a lot of projects going on. For the adults living with SMA, there's another exciting project called the Daily Life Study. Now, it has been on our socials, and there is an incentive for people who want to take part in it. And this is really interesting because it's all linked to your phone. So you get, I think it's between 6 and 12 alerts a day. And it tells you to complete this questionnaire, and it's about your fatigue levels or pain levels. And then that all goes into this graph. And we saw some interim data on this project. Now, I thought it would be a real burden for people having to answer questionnaires so often during the day, having an alert, who knows what you'll be doing. But it seems like the project's going really well. And actually, the UK has been one of the highest uptakes for this project. And what this will do is give people an idea of really what it's like living with SMA, and it will help big research studies with their like outcome measures and having some real outcome measures that actually make sense. And we know where they're coming from, and it will help, just helping form lots of different research products. That's a really exciting one as well.
Yeah, I think it's really clever because it's real-time data that is not being diluted by clinicians interpreting data and drafting a report about it at the end. So that's really clever. I like the sound of that. And I actually have an email in my inbox about that. So I might actually give that a look.
Yeah, and I feel like that's really what it's all about. It's about coming together and painting a real world picture of what it's like living with SMA, so that we can get what we need and get the best outcomes.
Yeah, absolutely. So, I mean, there are a lot of people that will probably be watching this and listening to this in the community that already know you, and they know that you're a mum of Ezra and other children as well. What is that like? What is that dynamic like for you to have to travel to another country to go do these amazing things and leave your family behind for the time that you're away?
That's a good question. And it wasn't easy, to be honest. It's the first time I've been on an airplane in over 10 years. It gets longer every time I tell this story. I think it's probably been about 15 years since I last spent on an airplane. And my son obviously heard I was going away because he got poorly just before I left. So he had really quite a nasty cough and was being sick. And I was like, do I go? Do I not go? So there was definitely a lot of stress associated. Now, I'm very lucky. We have got a really good package of nursing care. So I had all the nurses in line, and I had to just tell myself, it's going to be okay. They can cope without you. And actually, it was really good for me almost that he was poorly when I was away, because it proved to me that they can cope without me. It enabled my husband to, get off his bottom and do a bit more medical stuff. Good thing, not very forthcoming usually. So it's given him confidence, given me confidence, and it's giving me a real travel bug, actually. I really, really want to do it again. So I'm determined to, take Ezra on an airplane soon. When he's still little, I can carry him.
Yeah, that sounds really cool. I think it'll be a lot easier with the airlines having the ability to carry Ez instead of having to worry about all the other stuff that we normally have to worry about. So if you can, I'll delete that out afterwards. So if you can think about the whole trip and the whole event, what was the biggest highlight for you?
I think the biggest highlight was the treatment committee and just being on an advisory board and being able to talk to people like yourself and being able to talk to other mums and dads and to take all of that information and knowledge and need to the people that can really make a difference. It was empowering. That was probably the best thing. Oh, and meeting the people from SMA Europe, because I see them on a screen. We have meetings every so often, but I never felt like I really know these people. And now that, we've got relationships, we've shared pictures and made friends, now it's going to be much easier to communicate with them. And I think I can see my involvement in SMA Europe really increasing now that now I have relationships with these people. It's going to be much better, and it's quite exciting.
That's awesome. That's really great to hear. Well, I want to thank you for joining me for this chat. It was really informative, actually, and it's really great to see how the world is coming together to try and create an as even playing field for people living with SMA as possible, and the fact that there's that desire and hunger to find better ways of doing things for the future generation as well.
I'm really keen to find out what the community's needs are. So please email me. I am embedded in the family community. I speak to mums and dads all the time. So if there's any adults living with SMA there that have a burning desire for me to help them advocate for something, then please get in touch.
Definitely, I would highly recommend reaching out to Portia either via our Instagram or email, or even Portia's Instagram directly. It would be really great to have more voices on this and give you the information and support that you need to advocate on our behalf going forward.
For sure.
Awesome.
Thanks, Learning.
Thank you very much, Portia, and I will chat to you soon.
Yes,